I started telling my mom when I was 4 that I wanted to be a pediatrician. I loved going to the doctor. When I was on my surgery rotation, I was doing an outpatient clinic with an ophthalmologist, and the clinic was a pediatric ophthalmology clinic. And I was in the clinic for less than an hour before I realized I needed to be working with children. I've been a pediatrician, I'm going on 20 years, and I've seen kids, grow from babies to college age, and it's been really wonderful. I love making these connections with families, watching kids grow, and just forming really great bonds with them. Sometimes I'll meet with parents before they have their child, and I want to make sure that they are comfortable with me. They know who I am and kind of what I stand for. I am very open. I want to make sure that they understand that I'm willing to sit with them and talk, and I want to make sure that when they come to me that they bring lists of questions so that they walk out with everything answered. I also want them to know that they can always reach out if they have questions, that I'm always open and available. Helping keep children healthy, developing, growing, but we're also very vigilant about making sure that if there's something wrong that we're noticing it early, and we're aware, and we're watching for things. If there's an issue, we're addressing them early. We're, making sure that we don't miss things. I'm actually a grand doctor now, and it's kind of fun because I have patients that I kind of started with, and I also love that, those patients that I used to take care of trust me to take care of their children. I feel like it's another step in my career. I want families to know that, I'm a pediatrician, but I'm also a mom. I currently have 2 teenage children, but I'm also a host mom. I've hosted exchange students, and I've been through the parenting thing as well. And I have a lot of, by the book recommendations, based on what American Academy of Pediatrics recommends. But I also have a lot of, personal experience recommendations and practical recommendations, and, that I can give to parents as well. I also love to cook. My family says that if I was not a pediatrician, I would open a restaurant.